So, good morning, friends. Today we are going to study a new topic, that is clinical examination of sensory system. Now, this topic had already been covered for the A batch of first year MBBS. Due to the corona and lockdown, a certain interruption was there. So today we are recording the further part of the practical, or the same practical for the batch B and C, those who have not covered this practical. So the sensory system is mainly already covered in the theory topics. Winkler madam has already spoken about the charts, the ascending tracts, descending tracts, receptors. So basic theme is already there in your mind. And now today what we are going to see is how to examine the sensory system. So before going to that, we'll just see the points. There is, first we'll see the introduction, then the symptoms, then various clinical points which we are going to focus on. So whenever a patient comes to us, he will tell us some complaints. These complaints are called as symptoms. So the main symptoms of the sensory system are loss of sensation, loss of all sensation, reduced sensation, increased sensation, then any tingling or altered sensation, which is called paresthesia. Hyposthesia is decreased sensation. Then analgesia is reduced pain sensation. Anesthesia is reduced or decreased all sensations. So such things are there, and commonly the diabetic patients and a common disease which is leprosy, in this you have mainly problems of the sensory system. Also, if there is any lesion in the spinal cord or more higher medulla, thalamus, or in the cortex, all these also play a role in giving various symptoms of the sensory system. So now we will see the examination part one by one. So before going to this practical, you should always know what do you mean by receptor, what is a dermatome, what are the tracts, what are the ascending tracts, how they work, how they relay the messages, what is first order, what is second order, what is third order. So all these concepts should be there in your mind, in your reading, before going to any of this clinical examination. So we'll start the first examination, that is tactile sensation. So tactile sensation has fine touch and crude touch. Now when you study the tracts, you will understand that there are certain functions of dorsal column tract, there are certain functions of lateral spinothalamic tract, and there are certain functions of anterior spinothalamic tract. So mainly the dorsal column tract is responsible for fine touch, sense of vibration, sense of stereognosis, proprioception. These are the function of dorsal column tract. Anterior spinothalamic tract is related to crude touch, itch, tickle, and lateral spinothalamic tract is mainly responsible for carrying the sensation of pain and temperature. So we'll see one by one how to examine these things. So first point is tactile localization. Now this is also known as topognosis, tactile localization, in which we will examine how the person is able to localize a particular thing. Now fine and coarse, these are two words. Fine means you will be using very soft soft material like a wisp of cotton for examination, and crude is you can examine by touching. Now by rule, for all this examination, the eyes of the subject should be closed. He should not open his eyes, because if he open his eyes, if he keeps his eyes open, then he will be able to see. So whatever we are going to do is, the main thing here is he should close his eyes and he should give the reply to whatever questions we are asking. So in tactile localization, we have fine touch and crude touch. In tactile discrimination, it is the ability of a person to distinguish two points as separate entity. Now tactile discrimination we will be using an instrument called compass aesthesiometer. So in this you will have 2 points, you will keep it on the body and go on reducing the distance. Then at a certain point he will feel that these 2 points are 1, and that point you have to record. So this is tactile discrimination. In tactile localization, one instrument is used, that is one phrase hair aesthesiometer, that is used for examining the sensitivity of the touch. So these things will be more clear when we take our demonstration. Now pressure. You know the receptors, here the Pacinian corpuscle for the pressure. We will examine the pressure by keeping a finger, we will press and we will ask whether he perceives it or not. This is how we check for the pressure. After pressure, we have pain. Now as you know, pain is a sensation which is having its own benefit. It tells you that certain things which are occurring around you are harmful. It prevents from getting more and more tissue damage. Okay, so pain actually arises when there is tissue damage, and it makes you alert that further tissue damage should not occur. So pain is beneficial in most of the cases. Like the cancer pain, in the initial stage you do not get the pain. So anything which is painless can turn out to be malignant later. So pain is that way very important symptom. And to examine the pain, here we have cutaneous pain and the deep pain. For cutaneous pain, we will be using a pin and we will be touching the person with the pin, slight pressure, and when he perceives, he has to raise his hand. Of course, the eyes will be closed. For deep pain, we have to grasp the muscle and we have to pinch it, or you can also hold the tendo Achilles and pinch it. So the main thing you have to see here is the wincing, and also you can raise the finger. Now the temperature sense. For temperature, we have to use instrument called hot and cold spot hammer. Also we can use test tubes in which warm or cold water is added. So it should be around 8 to 10 degree above and below the room temperature. And for temperature sense, this test tube should be interchanged alternatively. Do not follow the sequence cold, hot, hot, cold. The person will get used to it and he will give you he can predict the answer. So you go on changing it. Now one of the important sensation is proprioception, in which the inputs are given to the cerebellum as well as to the cortex, actually where and how the body parts are moving, the orientation. So the sense of position is ask the person to close his eyes, the examiner will hold the hand and will make a movement at the first at the proximal joint and then at the distal joint. First we will check the proximal joint and then we will check the distal joint. So he has to move the hand, passively move the hand of the subject in a particular way, and then the subject has to do it on the opposite side. This is for sense of position. Then appreciation of movement and sense of position are ideally checked together. So for appreciation of movement, we can hold the great toe at the metacarpophalangeal joint and we can move it downward or upward, and then ask the subject actually where it is, whether it is upward or it is downward. This is appreciation of movement. We can also tell about the direction, when we are going upwards or when we are going downwards. Then the vibration sense. The vibration sense is one of the important sense. Usually it is lost earlier in the diabetic patients. For testing the vibration sense, we have to use a tuning fork. Usually the tuning fork of 128 cycles per minute is preferred. In physiology, we have various tuning forks, 100 Hz, 128, 512, and so mainly for vibration sense we use the 128. Higher cycle per second tuning fork are used for auditory testing. So always remember, vibration sense you should always pick up 128 Hertz tuning fork. Then the seventh point is stereognosis. Stereognosis is the ability of a person to identify an object with blindfolded with looking at its shape, size, texture, weight, and this object should be familiar to him. So after closing eyes also he can tell what actually that object is. That is called stereognosis. It is mainly the cortical function and many sensations are combined in this. Then tropic changes. Tropic changes are the changes which are seen in a person whose nerve supply to a particular part is cut. So usually the skin becomes the skin is hampered, it becomes lusterless, then you have hair loss, bones become brittle, the joints become deranged. So all these tropic changes are seen in the lesions where you have damage to the nerve which is supplying to that particular part. Examination of spine. Now clinical examination of sensory system is never complete unless you examine the spine, because the spinal cord is playing a major role. So you should see for the tenderness. You will palpate and you can find out the tender points. Then when you palpate we can see the deformities if there are any. Usually there is pot spine, that is TB of spine, which can give deformities. Also you can have bony lesions, metastasis, and this can also give deformities. In old age you have osteoporosis that can also give the deformities. And then we have to check for the movements, if the person is able to do the movements, forward bending, backward bending, side bending, lateral flexion. So all these things we have to check in the movements. So for mainly the UG students, our main focus is how you examine. As you know, we don't give you the patient for examination, nor we do not have any clinical scenario. We want to check how much knowledge you have about it and how is the approach, how you examine, how is your technique. So these are the things which we want to focus whenever a first year MBBS student is examining a subject. So after this we will have a demo. Before that I will tell you what are the things you have to do in the journal. In the journal you have to draw the diagram of the dorsal column tract which will be attached in the video, and also you have to draw the diagram of anterior spinothalamic tract. So these two diagrams you have to draw in the journal, and whatever clinical points we are going to examine, those things you have to examine on your friends and enter in your journal. Okay, thank you. So now we will move to our demonstration. Okay. So now we will start with the clinical examination of sensory system. As we already discussed in our briefing part, now we will demonstrate how to examine how to examine the sensory system. There are certain things you have to remember. We have to ask the subject to close his eyes. This is the first prerequisite. Second thing is we should know the dermatomes, and we should always check according to the dermatomes. So we will go to the first point, that is tactile sensations. In that, first is tactile localization. So for the fine touch we are going to use the wisp of cotton. We will ask the subject to pinpoint where you have touched it. हात लाव, इथं कुठे हात लाव, ओके, इथं, इथं, so you will check it on the face, upper limb, trunk, and also in the lower limb, and you have to ask him where you can feel it. This is for fine touch. For crude touch, we can use the finger. So I will keep my finger. कुठे touch केला? Okay. You will do it on the face, upper limb, trunk and the lower limb. Now the second part in tactile sensation is tactile discrimination. For tactile discrimination, we will use the instrument compass aesthesiometer. When in exam we will be given this instrument. So first we will ask him whether he perceives 2 points or 1 point. First we will increase the distance. First we have to touch simultaneously and he has to tell whether he feels it as 2 points or 1 point. The moment he feels it as 1 point, we will take the reading. Now this tactile discrimination depends on how many receptors are there. Usually on the back the distance is more as the receptors, touch receptors are less. In forearm it is medium. On the tip of the finger very less distance can be perceived as 2 points, and tongue is also very sensitive. So we will first start on the back. पाठीवर point लावणार आहे मी तुमची. Now I will ask him whether he feels it as 2 points or 1 point. दोन आहे काय दोन सांगायचं, दोन आहेत काय काय सांगायचं नंतर. So now we will see whether it is now he has told it is 1 point. Now we will check. It is around 7 centimeters. So it is 70 mm. Now we will check on the forearm. Similarly, you have to check on the opposite side as well. Now we will check on the forearm. दोन म्हटलेले पाहिजे. दोन So here it is around so it is around 15 mm. Now we will see on the finger, similarly on the opposite side. Down. Here it is around 15 mm. Now on the fingertips. Down. Okay. It is around 2 mm. So on back it is around 70 mm, forearm around 20 mm, and on the fingertips it is about 2 mm. So fingertips are more sensitive. This is how we can check the tactile discrimination. After touch we will see for the pressure. We will keep a finger or a back of a pen and we will give pressure and he has to raise the hand. When he perceives, he has to raise the hand. Okay, this is how you check for the pressure. Now for pain, first is the cutaneous pain. Here you can use a pin. We will touch the pin, we will press it a bit, and then when he perceives the pain, he will raise his hand. Raise करायचं, हात वर करायचं. Usually we don't check the pain sensation on the face. Trigeminal nerve supplies the face. Okay. For deep pain, we will pinch the muscle and check for the wincing, and also will raise the hand. Now we will see the temperature. For temperature sense, we use this hot and cold spot hammer. We have to touch it on the same dermatomes with the eyes closed, and he has to tell whether it is hot or cold. So in this we have the cold, in this we have the hot, warm water 10 degree above the room temperature, and cold is 10 degree below the room temperature. Warm है को cold?
Warm.
Warm है को cold?
Warm.
Warm है को cold?
Warm.
Warm है cold?
Cold.
So we will go on interchanging, don't follow a particular sequence, and then ask him whether it is warm or cold. Now joint sense and position, we will move particular joint and he has to do it on the opposite side. So first upper limb, the proximal joint, तुम्ही तसंच करा. Now distal joint. Okay. So we can perceive the movement. Now appreciation of movement, the direction. So you hold the great toe, eyes closed, asking whether it is upward or downward. खाली है कवर? खाली है कवर? So he can appreciate the movement. Similarly, you can do it here. खाली है कवर है? खाली है कवर है? So he is appreciating the movement. Vibration sense is checked by the help of a tuning fork. In exam, we will be given a rubber pad on which you have to hit and keep it on the bony prominence. Once the vibration ends, he has to raise the hand and we have to keep it on our same bony prominence. Now the bony prominence we can examine are the medial malleoli, lateral malleoli, shin of tibia, styloid process. These are the bony prominence which we can test. So we will be checking it on the elbow first. Whatever you do on the right side, you have to do on the left side. So equal dermatomes we have to check. थांबलो की बोट वर करा. थांबलो? Okay. So vibrations have stopped. Now we are checking on our own. Yes, the vibrations are stopped. So this is how we have to keep it on all the bony prominence on the same dermatome, right side and the left side. Now the last point, stereognosis. In stereognosis, we have to give him some object which he already knows, but with his eyes closed, he will identify it with the texture, size, weight. So this is how it goes. First, ask him to close the eyes. Diameter. काय आहे सांगा? Chalk. So taking it in the hand, feeling it, he can tell whether what object it is. Now on the opposite side, we will give some other object. Okay, so he is saying it is an adhesive tape. So this is how you can try out with 3 to 4 objects and we can get the information of stereognosis. Now the trophic changes will be seen in the patient who has a problem with the nerve supply cut down to that part, and in the examination of spine we have to see for any deformities, tenderness, and we have to check about the movements. So forward bending, lateral bending, side bending, twisting, all these movements you have to check and ask whether you get any pain while doing these things. So this is about the demo of sensory system.